Hi, this is Sherri Douville, CEO at Medigram, and I want to share with you how people get COVID and some common sense tips to help you prevent from getting it and to help people understand how they can help prevent to spread COVID. Now, you wouldn't leave your house without locking your door. And so for those locks that many of us use or grew up with, the key is fitted to the lock. And that's exactly how COVID is able to infect so many people. It's a spike protein that acts like a key that attaches to an ACE2 receptor. So let's go ahead and take a look at how that actually works in practice. ACE2 receptors are found primarily in our upper airway, is where it would come in through our nose and mouth. But then in terms of our eyes, in Wuhan, they found that people that wore contacts got it more than other people. So since I have contacts, I also use eye protection, which I'll show you in a few moments. Now, in terms of what healthcare providers should be thinking about, N95 rated, which is rated for the filtration efficacy. The CDC has put together a nice resource with the National Institute of Occupational Safety and Health, and it shows the list of all the brands and the models that have been tested for efficacy. And we recommend that you try to find these and have these for your work as a first line healthcare provider. For those of us who are civilians, let me show you why you want to think about having the correct type of mask. So many of you have talked to me about or asked me about the Danish study, which was based on surgical masks and also is not controlled for the wear of masks. When I say the wear, whether or not it was covering the nose, whether or not there was a good fit. So let's just talk about some physics basics that can help you think about how you want to select mask fabric and mask fit. If you look here, this visual capitalist diagram will show you the coronavirus right here in the dark pink to the left of the screen is about 50 to 100 times smaller than a dust particle. So when you think about the dust particle here is depicted in the tan in the middle of the screen. So I've got some powder here. And when you think about, and say if I'm gonna put some, in the air, and if I don't have good air change, meaning ventilation and filtration, and I don't have HEPA filters running, and I continued to spread this powder out, I'm going to start sneezing because it's going to accumulate, that's what happens exactly if you have people who have coronavirus, that it can accumulate in the air in these particularly indoor spaces. And so you want to think about protecting yourself from that. And one place, which is a good resource, Dr. Shelley Miller recommended, who's one of the top aerosol scientists, this discount safety gear where civilians can buy KN95 masks. So how do I think about protecting myself when I'm going to go, say, for example, run an errand? If you look at this MIT medical site, it'll show you all the studies that show the basic science of the types of fabric and the filtration that they offer. So you want to be looking at a multi-layer approach, kind of like you're going to go skiing or do anything in the elements, you're going to wear multiple layers. Should be the same thing with your mask. And the way the masks work is they work through electrostatic charge, which means that they attract particles based on the electrostatic that the material creates. And that is done better with a higher thread count. And so what we want to think about is layering masks with a correct fabric and using a good fit to make sure that it works. And so what I'm using is a highly rated KN95, comes with a certificate, made of melt blown fabric, 5 layers. And I'm going to put it carefully over my ears. And I'm going to grip the nose, and you'll see that it's a nice tight fit around my face. There's no gaps. Because of the spread in the community, I'm also going to put this double layer, high thread count cotton mask over my KN95. And that'll protect my nose and mouth from getting COVID up into my ACE2 receptors that are in my airways. Now, what about the ACE2 receptors in my eyes? That is where I wear sunglasses. And I also put goggles on top of that. So this is how I would go out to run an errand. So hopefully you can see now how different fabrics of different layers will have different levels of efficacy compared to some of the things that you may have heard of that have been used in the past. And I know it can seem confusing, but if you think about it just in terms of multiple layers, everything, whether it's masks or the way that we approach protecting ourselves. I talked last time about the Swiss cheese model. And so there is no one intervention that's going to be foolproof. So even though I've told you to wear this well-fitting KN95 mask with the 2-layer cotton mask over it and the goggles, I'm not guaranteeing you that that's foolproof. What I'm saying is that there's multiple things that we can do, and we should look at doing really all of those things: distancing, masks, using hygiene, and also managing our air. So hopefully you have a better sense of why there's been confusion, and you have more clarity around what kind of masks to use and how to use them. And you can share this with all of your friends, family, and colleagues, and let's beat this disease.